technology presentation on paradigm shift in digital radiography by Mr. Manjunath Arumugam, Application Manager, India, ACFA Healthcare. Mr. Manjunath, kindly step on stage, please. Thank you so much.
I'm happy to be part of this summit. I'd like to give a small introduction about the company and the products we offer. We'll start with the CRs. Having more than 150 years of experience in imaging industry, and we also offering several products ranging from different categories. We'll start with the CR modalities. Based on the customer need and the volume, it will be starting from small 10x to the maximum DXM range. The advantage in CR, what could we make different will be the needle pulse per imaging technology, which is similar to a DR technology that also we offer, and successfully the customers are much happy about the image quality with the needle pulse per cassettes as well as the ACFA's image quality. So based on the need and volume, you can choose your product. When it is coming to the printing solution, whether it is a normal X-ray, ultrasound or CT and MRI, there will be a different, either depend on your space restriction. Either you can go for the tabletop one. If you want to do a high resolution printing, then you can go for the Dry-Star Axis, which is a highest DPI printer available with ACFA. So you can more confidently print your CT and MRI films with ACFA. Not only that, we are also having a big portfolio in DR, where we start with retrofit DRs, which we recently launched the XD panel range, the Dural line, which is more durable and maximum output, highest in the industry now with up to 16 hours of battery backup with the retrofit panels, as well as we have a wired MAM of retrofit panels. Then we have a floor mounted DRs, ceiling suspended models and the mobile DR. Based on your needs and your room restriction and the case volumes, we can offer this. When we speak about the things about the image quality and other thing, we definitely have to mention about the Musica, which is our patent software, multi-scale image contrast amplification, which is the best in the industry, we could say. It will divide the images into 12 different slices, segregate, analyze, and finally give the proper output, where you will have a diagnostic confident. Definitely, every time there is a image processed in the Musica software, you will have a confident about the diagnostic quality. And there is no different set of team will be having different image quality. Whoever operate the machine with a one-click workflow, there will be a much easier image quality will be provided with the Musica images. And when coming to the dose mainly, as per the Frost and Sullivan reports, ACFA images are up to 60% dose reduction compared to anything in the industry available. So when you talking about the patient dose, it's always a question mark. There is no confident about how much dose we are going, how much repeat cases they are doing. So where with ACFA, you can reduce, and there will be absolutely 99% there will be no repeats necessary with the images. And this Musica software is not only with the premium DRs, it's also available with the basic CRs also. Either they are going with the CR or DR, it will be the same software which is provide the best possible quality available. When we are coming and talking about the AI and the artificial intelligence in the radiology field, we already implemented this with our DRs, with the DR600 and DR800, where we have implemented a different type of AIs. The first one to start with in the smart XR segment, it will be a smart dose, where the system will have a three-dimensional camera which will capture the patient details and it will analyze how much the patient thickness was. And it will suggest to the radiographer how much dose he has to select. We also having AEC, so which will decide how much dose given to the patient, but with help of this smart dose, it will further reduce the dose to the patient and easy the work of the radiology team. So with this, maximum, we can get the output from any machine with fewer retake, because it's automatically deciding based on the patient thickness. So we no need to, in the olden days, they used to calculate literally how much MAs we had to give. Sometime in the very old conventional method, they used to literally take a scale and measure the patient thickness, then decide how much kV and MAs to be added, which the machine will do now. So they absolutely go freely without any much worry about the patient thickness. They confidently go for the images. Again, it is a patient-tailored dose. There will be no patient-tailored dose available with normal machines. Like if it is a normal patient, give this much. If it is a fat patient, only give this much. It is not like that. Each and every patient have a different body thickness, even though outside it looks same. So with help of this infrared rays available with smart dose option, every patient will have an exact dose required, not extra, not a low. In Smart XR, the second segment will be the Smart Rotate option. Like most of the time in the olden days, we used to have a manual dose in the cars. Now almost everybody having an automatic, just push the button and having the doors windows closed because of the advantage. When we see in the Smart Rotate, it might be look very small. It will automatically rotate the images without a manual intervention. So the radiographer no need overlook the images after they took the images. They don't need to wait on every image. Sometimes the patient volume is too much busy. Once they finish the X-ray, they want to go for the next. So with Agfa Musica and help of the Smart Rotate, they can just finish and go for the next one. They don't need to wait for the patient images to be rotated and then sent to the PACS. With Smart Rotate, easily they can do the workflow, and this is available even with CRs now. Agfa has already started providing this Smart Rotate with full entire range of the product, so they can start using this also. When it is going to the mobile units, it's always a challenging method how to get the proper chest X-rays or any mobile X-ray images. With help of the Smart Align technology, it will say where the detector exactly is there, whether it is purposely aligned. It will give the live feedback whether you have to rotate this into 5 degree or 15 degree like that. So the radiographer will have more confidence and the images will be more clear. So tube to panel alignment will be accurately fixed. So they no need to take a repeats. Bedside imaging is always a challenge one. To take a repeats will be always a headache. With help of Smart Align technology, it will ease the radiographer's life in the bedside imaging. It will have very almost zero mistakes will happen because of this Smart Align technology. And I know ICU X-rays are very crucial in everyday diagnosis. So this will have increasing the patient confidence and reducing the repeats in ICUs and as well as in the wards, so to get the best quality out of it. When it is coming to the smart positioning, like the radiographer knows the positioning, but this will add the confidence and increasing the quality of the images. With the smart positioning, when where a patient is positioned before the detector, it will give the green tick marks with the AECs. So the radiographer will have confident that sometime if the female patient is there or some other reason the room is totally closed, with help of this they will have a confidence that yes, the patient is exactly positioned and the green tick mark is there, so then they can go ahead and expose the patient. It will reduce again the repeats, and we no need to take the repeats and retakes because of the dose or the patient positioning. This will increase the workload volumes. With the help of live vision technology, we will have a camera view of the patient, so it will have a confidence. Sometimes the pediatric cases, it will be very difficult to manage when somebody has to come in, or the very elderly patient. So we will always have a live vision. It will be operational efficiency and clinical performance. Again, it will reduce the repeats. So again, when it is coming to DR, it is easy to repeat the images because it is instantly available. But when the technology is ready to serve us, why we should do again extra irradiating the patient? So again, it will help to reduce the repeats and increase the workflow and increasing the confidence when you are taking the images. Musica and Smart XR will give the perfect pair. First time right, that was we are trying to. There will be absolutely zero errors we are trying to get in any radiology. So that will be exact goal for any radiology. So that there will be no repeats, no bad image qualities. With the first time right, Agfa is ready to provide that. with the confident. That was we are trying to say. It will be, clinical performance will be 100% achievable with ECFA. Coming to the next level, with the DR600 we have Smart XR. Adding to that, like icing on the cake, we also having the product called DR800, which is a digital fluoroscopy, which will have everything together, like a Swiss Army knife. Either you can start with a fluoroscopy procedures or a general X-rays. This will have a perfect solution for your radiology and imaging department without adding anything extra. This will have advanced clinical application. You can do a fluoroscopy as well as a digital tomosynthesis. This will bridging the gap between conventional digital CT and a normal X-rays. Sometime it will be, it's not necessary the patient to go through a CT. So with this particular DR800 and digital tomosynthesis, we can reduce the time. Hardly the patient may spend 5 to 10 minutes maximum in the department to get their chest tomosynthesis done. Then you can analyze the images. Even this COVID situation, chest X-rays and chest CTs are most advanced, important given and diagnostic. With this help of digital tomosynthesis, we can get clear details out of lung fields and any other bone details. We'll get the clear image quality and diagnostic confident on that. Adding to that, when it is a cath lab procedures, complication procedures are there, it is not easy to give the room for the next patients. So with digital angiography, we can reduce that to the department load. Like instead of going for the light angio procedures, we can do this in DR800 room itself. Adding to that, we are also having a road mapping, a DSA and as well as the road mapping. So with help of road mapping, even the small stents can be placed in the fluoroscopy room itself. They no need to go for the cath lab procedures. So this is some sample images from the tomosynthesis where we can have a clear details of lung field. The advantage here is early detection rates of cancer and other diseases will be easily found. They no need to wait for the CT procedures to be done. And compared to CT dose, it is much, much lower in the X-rays. With a normal nominal dose, we can get the best quality out of it and get the best diagnostic details out of it within the X-ray room itself. And apart from the normal fluoroscopy, DSA and tomosynthesis, we are also having a easy stitch technology, which will have a full leg and full spine images possible with this. So they no need to, like for orthopedic cases and some spine scoliosis cases, sometimes they have to refer to the different set of images or different clinics. With this machine, even that is possible, where the patient have the full length of spine and full length of like from pelvis to toe, they can take the images very easily within a minute. Adding to the full leg images, we are also having a software called Orthogon, which will help the complicated measurement within the seconds. Orthogon is the only software available in the market now for the easiest processing software, which will enhance your images. It is having a full leg measurements, full knee measurements, even the scoliosis measurements. Like that, we can give the number of list. So the orthopedic doctors will have appreciate this option when it is going along with your X-ray images. Apart from this, we also having the neonatal imaging package and pediatric imaging package, so which will adding the values. So with one room, you don't need to have a multiple rooms for different procedures. With one DR800, whatever the images, whatever the requests coming in the department, we can finish it off. Like either it is a normal procedure, a normal chest X-ray, or a complicated DSA procedure, we can finish it off in single room. Sometime with the fluoroscopy models, we can't do a chest X-ray because the tube will be very limited to the 100 centimeter or maximum 150 centimeter. With this DR800, we can also increase this to 180 centimeter to the source imaging distance, so we can easily and confidently take the chest X-rays also. And we recently launched the neonatal imaging package, which is very crucial in pediatric and neonatal imaging. With help of the Musica software, we have developed the best image quality possible with a lower dose, and we introduced the Duraline panel XD plus 10. So this is the highest industry resolution available with 125 microns with a 75% DQE. So it will be very crucial for neonatal imaging. Absolutely no errors possible in neonatal imaging and no repeats required because of the sensitivity to the neonatal kits. So with this particular package, we will have, like as I said, Musica is the advanced technology with imaging. With this, the latest software, we added the one more detail called fractional multiscaling. This will give increased image quality to the images. Wherever compared to any other normal images, this fractional multiscale processing will give minor details to the pediatric imaging, so you will not miss any details. And we are also having a catheter visualization. So you no need to take a repeat. When then there's a patient center line is placed or any other lines or tubes are placed, they will try to take another X-ray. But when the normal X-rays are taken, sometimes it not be clearly visualized. With the help of this particular software, you no need to take a repeat images. With the first image itself, you will have a normal image. We have to just press the button. It will create a copy of the image with the clear lines. So wherever the lines and tubes are presented, it will be easily identified. And again, with a pediatric and neonatal, the dose is very crucial. So we are also having a dose monitoring software, which will give the clear idea in particular patient how many X-rays are done, how much dose the patient received. So this will definitely give, and adding to that, it will have a reject analysis also. So sometime in case, worst case scenario, they repeated. For that particular patient, how many cases are repeated? Or in 1 month or 1 week, how much cases are repeated or rejected due to which reason? Whether it is a exposure error, whether patient positioning error, that kind of list which can be done. So in future, in near future, they can avoid that particular issues. And this will give the clear dose report to each and every patient or each and every exams. So the dose monitoring will be much easier. So once we get this particular dose monitoring, then we can say, okay, this particular exam is having a higher dose in the volume. So this particular exam has to be revisited and reduce the dose as much as possible. Thank you.
Thank you so much, Mr. Manjunath, for your wonderful presentation. We will now move ahead and to our next segment, and I request the team. Yes, of course. I request Dr. Ravi Gupta to please present us to a small token of appreciation to Mr. Manjunath Arumugam, Application Manager, India, ACFA Healthcare. Can I have the team with the memento, please? Sir, please, if you could. Can we have a round of applause, please, for Mr. Manjunath Arumugam, Application Manager, India, ACFA Healthcare. May I request for a photograph with the e-health magazine here, please?